My name is Eric Thompson. Chloe, do you give permission to be in my video today?
Yep.
Okay, first thing I'm going to do, I'm going to wash my hands, apply gloves as necessary, and I'll also provide privacy for my patient as needed. My name is Eric Thompson. I'm a student nurse at the University of Toledo. What is your name?
Chloe Black.
What is your date of birth?
May 17, 2000.
I'll check her band just to be sure that what she told me is correct. Today I'm going to be performing a head-to-toe assessment. It's going to include vital signs, and I'm also going to be checking for any abnormalities throughout your body, okay? Do you have any history of medical issues I should know about today?
No.
Do you have any current health-related issues I should know about, asthma or heart-related or respiratory?
No.
Okay. Next, I'm going to check her position. I can see she's erect. She's making eye contact with me. She seems to be healthy. She seems to be well nourished. Hygiene-wise, she is dressed appropriately for this occasion. She seems to be well groomed. Her hair is brushed and pulled back, and she seems to be clean. Then I can go ahead and check her facial expressions. She is smiling. She's making eye contact with me. She seems to be in a good mood. I can go ahead and move on to her level of consciousness and orientation. Can you tell me your name?
Chloe Black.
Where are you today?
Here in the apartment.
Why are we here today?
Oh, head-to-toe assessment.
Okay, and what time is it about?
8 o'clock.
Okay. So, next, I can move on to her speech. Her speech was articulate. It was clear. I could understand her easily. Do you have any pain today?
No.
No pain, okay. Next, I can move on to checking her radial pulse. I'm going to make sure her arm's supported. If you can, for me, just remain quiet and remain still as well. Her pulse is normal. It rated about a +2 in strength. The characteristic is elastic, and the rhythm is regular. So I'm going to go ahead and count for 30 seconds and then multiply by 2. Okay, she had 72 beats per minute. That is within the normal range of 60 to 100 beats per minute. Next, I'm going to move on to checking her respirations. I can see that her breathing is quiet. The rhythm is regular. I would say it's eupnea. The depth of her breaths is within normal limits. And since the respiration rhythm is regular, I'm going to go ahead and just count for 30 seconds and multiply by 2. Okay, her respirations were at 16 respirations per minute. That is within the normal limits of 12 to 20 respirations per minute. Next, I'm going to move on to checking her blood pressure. So, is it okay if I move your gown down? Okay. Do you know your normal blood pressure?
No.
Okay. So when I check blood pressure, I'm going to, after I hear the pulse, I'm going to just go up and move 20 to 30 after that and check her blood pressure. Do you have an arm preference?
No.
No preference, so I can use either arm to check your blood pressure. I would check if she had a fistula, or if maybe she had a stent recently placed, or maybe she has an IV in that arm, or maybe she recently had a surgery on that side of the body. So I would just check for contraindications. Next, I'm going to measure the cuff, the width. Should be at least 40%. It is. And then I'll use the bladder of the cuff. Bladder of the cuff should be between 60 and 80% around. And it is. So this cuff is the right size. I'm going to palpate for the brachial artery. And then I'm going to line my mark up about 2 inches above where I palpated. Brachial artery. And then I'll make the cuff tight enough where I can slip 2 fingers under it. If you can, just remain quiet and still as I check. Okay. Your blood pressure was 108/76. That is within the normal range. Normal systolic is usually between 90 and 120, and normal diastolic is between 60 and 80. So yours was 108/76 in the normal range. Next, I'm going to go ahead and I'm going to assess your face now, your face and head. So I can see eyes are symmetrical. They are in line with the top of her ears. Her eyebrows are symmetrical. Nose is midline in her face, symmetrical. Her lips are a little dry, cracking a little bit. Her skin tone across her face is tan with some pinkish undertones. I know there's a few primary lesions in the form of freckles. I do see a secondary lesion of a form of a nose piercing. There's no irritation or redness around it. Both of her ears are pierced. I can see that's secondary lesions, and there's no irritation or inflammation at this time. Can you raise your eyebrows for me? Can you open your mouth wide? Can you close it? Can you puff up your cheeks? All right. All of her facial muscles seem to be intact and working well. So next I'm going to move on to her head. I can check her head. I can feel for any deformities in her skull, maybe any tenderness or pain that she may be having. I can check for parasites in the form of lice or any other parasite. I can check for lesions in her hair. I can check for baldness. I can check for, again, lesions. So I can check the back of her neck and the back of her ears for any lesions, redness, or inflammation. So next, I'm going to move on to checking your eyes. I will do the conjunctiva and sclera and cardinal positions. I'm going to skip that for now. I'm going to move on to perilla. So if you can, look right over my shoulder. I'm just going to check your pupils. Okay, 4 millimeters. And 4 millimeters. So your pupils are equal in size and they're equally round as well. Next, I'm going to check that your pupils are reactive to light. So if you can, again, I'm going to use this light, shine it in your eye, and then I'm going to check for pupil constriction. So if you can, just look right over my shoulder. Left pupil did constrict with light. Right pupil constricted with light. Now I'm going to make sure, I'm going to shine the light in your left eye, make sure your right pupil constricts. Right pupil did constrict. Left pupil did constrict. Good. Pupils are reactive to light. Next, I'm going to do accommodation. Just keep your eye on the end of the pen. I'm going to bring it toward your nose. And your eyes may cross, and that is normal. So I'm going to begin, okay? Just keep your eyes on the pen. Eyes did converge and pupils did constrict, so the eyes were accommodating. Next, I'm going to move on assessing your arm. Okay, so I'm going to look for skin color. Skin color is tan laterally, where it probably gets more sun. Medial on her arm throughout is pale. I can see some venous patterning. Maybe her skin feels a little cooled, so maybe because she's a little cold. Lesions, she has primary lesions in the form of freckles, evenly distributed throughout her arm. And then she has a secondary lesion in the form of a tattoo, medial, just superior to her elbow. I'm not noting any redness, inflammation, or any signs of infection anywhere at this time. Next, I'm going to palpate for pain, okay? So just let me know if you feel any tenderness or pain. Pain or tenderness, okay? Any pain or tenderness in there?
No.
On your fingers, anything?
No.
Next, I'm going to palpate for edema. There was no signs of pitting, so no edema. And now I'm going to check, use the back of my hand, I can check the temperature and I can check for moisture throughout her arm. There was no moisture and her temperature, her arm was a little chilly, but it was nothing abnormal. So next, I can check her pulses as well on here. I can check her brachial pulse, I can check her radial pulse, and I can also check her capillary refill just to make sure there's good circulation throughout her arm and fingers and hand. So next, I'm going to move on to your chest and thorax. So I can see that she's sitting up straight. She's not slouched over. I can see her chest expansion is symmetrical. Does not have any signs of like a barrel chest or anything. I can see that she's using her diaphragm to breathe, and I can also see that she's not using any of her accessory muscles to help her breathe, so she's not having any labored breathing. So I'm going to go ahead and move on to checking your breath sounds. So I'm going to start anteriorly, I'm going to start in the front, I'm going to do 10 spots, and then I'm going to end mid-axillary, okay? Just go ahead and breathe in and out every time I move. Breath sounds were clear throughout all lung fields bilaterally. Next, that was anterior. Next, I'm going to move posterior and check her breath sounds. So this is the same thing. Just breathe in and out every time I move. Her breath sounds were clear throughout all lung fields bilaterally, posteriorly as well. Next, I'm going to move on to her heart sounds. So I'm going to go ahead and listen to your heart, okay? So if you could just remain relaxed, remain quiet. I'm going to start at second intercostal space, and then right external border, and that's going to be your aortic. And then I'm going to do second intercostal space, left external border, and then it's going to be her pulmonic. And then I'm going to do third intercostal space, left external border, that'll be Erb's point. And then I'm going to do fourth intercostal space, left external border, that'll be her tricuspid. I'm going to do fifth intercostal space, midclavicular. And that would be mitral. I heard S1 and S2 sounds. I heard the S2 sounds at the base of her heart, and then I heard the S1 sounds at the apex of her heart. I didn't hear any S3 or S4 sounds. I didn't hear any murmurs or abnormalities. It was loudest at the tricuspid point, so I would use that point to get her heart rate. Next, I'm going to move on to checking your abdomen. So you can go ahead and slip your gown back on. Okay. As I check her abdomen, I'm going to lift her gown above her chest. And then I'm going to pull the blanket down below her waist and expose her 4 quadrants. Okay. Now I'm going to note that her 4 quadrants are symmetrical, and I can also note her umbilicus is symmetrical with the 4 quadrants. It is midline. It is inverted. I can note the contour. Her abdomen is flat. I don't see any signs of distension. I also do not see any pulsations. Lesions, I can see some primary lesions in the form of freckles, just inferior to her umbilicus. She does have a secondary lesion. She has a piercing in her umbilicus. I'm not noticing any signs of infection or redness around that. And I'm not noticing any signs of tertiary lesions or no vascular lesions such as bruising or bleeding. So I'm going to go ahead and move on to auscultation, palpation. So do you have any pain in your abdomen today anywhere?
No.
Okay. If she did have pain, whenever I do my assessing, I will end in the quadrant where she has pain. Since she doesn't have pain, I will begin in the lower right quadrant. So I'm going to go ahead and just auscultate. So I'm going to listen to your bowel sounds now. Her bowels were very active. I would say within maybe 18 to 25 bowel sounds a minute. That is in the normal range of 5 to 30 bowel sounds per minute. Also, I didn't mention, but I would check her skin color across her abdomen, and I'll note any variations if I saw any. Next, I'm going to palpate. So you said you felt no pain, correct? So I'm going to start palpating in the lower right quadrant. Just let me know if you feel any pain or tenderness, okay? Okay. So she had no pain or tenderness after palpation in her abdomen. Next, I'm going to move on to assessing her legs, and I'll just do one leg for this assessment. So I'm going to look at this leg. I can see, I'm going to start with her skin color. It is tan throughout, and I'm not noting any signs of variation. I don't see any skin discoloration at this time. I do not note any lesions. Besides, I do see one lesion. It's a secondary lesion. It's in the form of a mole, just lateral to her right knee. It is about the size of a pencil eraser. It is round. There's no irregular borders to it. And the color of it is about a light tan color. I can note her hair. She is shaven. Her hair follicles, though, are evenly distributed throughout her entire leg. Okay. Next, I can move on to palpating. So I'm going to go ahead and palpate, all right? Just let me know if you feel any pain or tenderness, and especially in your joints, okay? So just let me know if you feel any pain or tenderness. Any pain or tenderness?
No.
Any pain or tenderness there?
No.
Okay. Any pain or tenderness around there?
No.
Okay. I'm going to go ahead and palpate for edema. And I'm also going to palpate for the temperature and moisture of her skin. There are no signs of pitting, so no edema. I can use the back of my hand. I can check the temperature of her skin, and I can check for moisture. The temperature of her skin, her leg is warm, and there is no moisture. Do you have any tingling or numbness or pain in either leg right now?
No.
Okay, how about throughout your toes and feet?
No.
How about your arms, fingers, any tingling, numbness? Okay. All right, so next I'm going to move on to checking her dorsal and plantar flexion. Can you go ahead and just flex your toes toward yourself for me? Okay. And can you push against me? Okay, strength was even with bilaterally, and the strength was strong. And the angle of her flexion was around 10 to 20 degrees, which is in the normal range. Now, can you go ahead and just point your toes? Okay. And then can you pull your feet back? Okay, strength. Plantar flexion strength was strong bilaterally, and it was even bilaterally. The flexion was around 40 to 50 degrees, which is in the normal range of 0 to 50 degrees of flexion. Okay. Next, I'm going to check decubital ulcers. So I'm going to check for pressure ulcers. So I'm going to check throughout her leg. I'm going to look for any signs of ulcerations, maybe redness or some raw skin where it's rubbing. I can check the back of her heel for any signs of ulcerations. I can check her bottom of her foot, just between her toes, back of her legs, and I'll just look anywhere for any signs of redness, irritation, or ulcerations. Next, I'm going to go ahead and check her pulses. So I'll start with dorsalis pulse. I'll rate that pulse. It is a 2. It is normal. It is there. I'll move on to the pedis pulse. That is about a +2 as well, and it's elastic. The dorsalis was elastic and a +2, and the pedis was elastic, +2 as well. Next, I can move on to checking if she has any IVs. I can check her IV lines. I can check that her injection sites, make sure there's no signs of infection or irritation. If she has oxygen, I can check the levels, make sure the oxygen levels are correct. If she has a Foley catheter, I can check the line, make sure that there's no holes, and make sure it's not leaking. I can check the catheter bag, and I can make sure that she is having urine output. And then any other machines I can check and just make sure that everything's hooked up correctly. So now I can do my closing. I'm going to make sure my patient is comfortable. I'm going to make sure the side rails are up ×2. I'm going to make sure she has the call light and any items within reach, and then I will document any of my findings during this assessment.